On the interior, ONJE2481 marks a small cluster of cells with phenomenal ability to differentiate. This inner cell mass is made up of cells with the developmental potential to give rise to all of the body's many cell lineages, an ability known as pluripotency. And indeed, every one of the cells in your own body can trace its ancestry back to these few dozen pluripotent stem cells. The vast majority of the body's trillions of cells are differentiated, meaning they have taken on specialized properties and functions, and have lost the ability to generate cells of other types. Skin, muscle, blood, bone, and the nervous system are all made up of populations of differentiated cells. There is another type of cell, however, that remains less differentiated and retains its ability to give rise to other cell types. These cells are known as stem cells. Stem cells exhibit two characteristics not found in more differentiated cells. By definition, stem cells are able to divide and make copies of themselves indefinitely, a capacity known as self-renewal. This endless power of division is not limited to creating more stem cells, however. They can also give rise to a wide range of mature cell types. These unique characteristics make stem cells indispensable, both for replenishing the body's cells as they age and are lost, and for constructing the body itself from a tiny number of cells during development.
Stem cells have the remarkable potential to develop into many different cell types in the body during early life and growth. The two main types of stem cells are embryonic stem cells and somatic or adult stem cells. Stem cells can also be found in umbilical cords and placentas. Some religious groups believe that it is murder because they say life starts with two cells. However, there are still living cells in the umbilical cord and placenta when a child is born, but most families decide to throw them away.
Stem cells are positive in the sense that if people have damaged tissue or organs, you can take these stem cells and make them into a specific type of cell.
Stem cells allow us to pursue technologies that are better matches for specific patients, where we are able to potentially create cell, tissue, and organ matches that would be, almost dead-on matches for specific individuals. So you would not have to go through some of the issues with organ rejection or potentially the medications that come along with tissue or organ transplants that suppress your immune system. Plus, we've been able to, in the lab, create tissues from stem cells that we have never been able to create before. You have to get those tissues or organs from either individuals or other types of organisms.
Put them into patients who, for example, if they have heart disease, you can take skin cells, turn them into heart cells, and then put them inside that patient, and the patient would have their heart tissue repaired. So there's a lot of benefits, and I'm all for stem cells for helping people with these issues of damaged tissue.
Of an embryo in our country and according to our laws. Our laws say that life starts at conception. And so with that legal terminology around what an embryo is and what life is, that gives embryos, even if they are just fertilized eggs, rights